The wrap and roll is a much easier and more practical way to dress the torso instead of trying to sit the patient up and bandage. Step 1 is to measure the width of the torso, and you're going to double that width to give you the length of bandage to roll out. Usually the bandage is rolled out on a clean drape. The ends must match up. So if there's 5 ends on the one side, there should be 5 ends on the other side, because these are going to come together. And the bandage must go from the full length, one side, all the way to the other side. The bandage is laid out on the bed and the patient is moved across. As you see here, we rather roll the patient instead of sitting them up. This is now the secondary dressing. The primary dressing has already been laid out onto the patient, and the patient is just turned from side to side to roll that out. The same thing can be done with big pieces of gauze. Make sure that it fits to cover all the wounds, depending on the size, which would be posteriorly and anteriorly. And here we cover the wounds with the primary dressing. We are cutting the secondary dressing to fit the patient's torso from underneath the axilla to the waist. Should not extend over the shoulders. One end of the bandage is pulled across. The matching end on the other side is pulled over and secured here with staples. If you don't have staples, you can secure this with Hypafix. And you want this to be fairly firm, but not completely tight. And just to repeat, it should only be from underneath the axilla to the waist and not over the shoulders. Make sure each layer underneath the bandage is lying nice and flat and is not all crumpled up. And much simpler than sitting the patient up.